Good evening, everyone. Welcome back to ZIZ's HealthWise. We are now starting our Season 2, Episode 1, and you have on the panel this evening all of our lovely hosts from last season. My name is Ms. Clilia Davis, and I have with me Dr. Monique Lescott and also Dr. Joeann Davis.
Hey everyone, it's a pleasure to be back. I'm looking forward to sharing a lot of information with you. So stay tuned in as we discuss a bunch of different topics that we are positive that you will be interested in.
Welcome back everyone. I'm just happy to be here.
So for this evening, we are going to be talking about the health priorities in St. Kitts and Nevis. And this is going to be something very, very interesting for all of our viewing and listening audience. So make sure you stick and stay for this episode, and we'll be right back after the short commercial break. Thanks.
Our world is filled with rhythm. Rhythm that's unapologetic, infectious, timeless. Rhythm is commitment in action. It's how we show up for each other with unrelenting support that goes the distance. Rhythm lives in the tiny beats of our most intimate moments and the seismic roars of our biggest achievements. Rhythm is resilience in motion. So even when things go out of sync, we do what it takes to bring the rhythm back. At Flow, we understand your rhythm because we live it. That's why we're dedicated to building a network as resilient as you, with a team of familiar faces working every day to keep you on beat. You're at the heart of everything we do, and our commitment is to keep your rhythm flowing, no matter what.
Smart Electronics, your one-stop shop for all your electronic needs. Unlock cell phones, tablets, laptop computers, Bluetooth speakers, TVs, mobile accessories, memory cards, USB drives. We carry all major brands. Now you don't have to go anywhere anymore. Everything's available under one roof. Mort Electronics at Port Sante opposite the food court. Telephone 466-4271. Visit our website at dutyfreesmartelectronics.com. Smart Electronics, way to live a smart life.
All right, welcome back everyone. So, as we mentioned before the break, our topic this evening is going to be health priorities in St. Kitts and Nevis. And first, we want to just create some context in terms of what that means. So, within our federation currently, we know there are certain issues that we are facing, and it's having a higher incidence as the years go on, specifically when it comes to certain diseases such as hypertension, cancer, diabetes. And so we must ask ourselves, why is it that these things are becoming more prevalent, and what are the effects of certain diseases that we see? So I am a medical scientist, but I have two physicians here with me that are going to give some insight from the clinic in terms of what they would see in terms of the different incidences that they would experience, and give us some more details. So, Dr. Davis, you can tell us. I know one of the top concerns right now that the Ministry of Health specifically is trying to create more awareness around is the non-communicable disease, or NCDs, that we are currently experiencing. Can you give us some, shed some light in terms of what some of those are?
Okay, so currently we're seeing a lot of hypertension, diabetes, heart diseases, and cancer. Now, hypertension and diabetes, these have the highest rate that we notice among our population. And once upon a time, it was considered old people's disease. So you would expect that as you get older, you start to develop hypertension, diabetes, and heart disease. However, we're now seeing an increase in these diseases in younger population. For example, we see persons with hypertension in teenage years, which once upon a time is crazy, but now we have persons, you know, coming in and being diagnosed with such things, heart diseases and diseases, and they go on with their entire life without knowing what is happening to them. So persons might experience a lot of migraines and stuff like that, and you might be thinking, okay, maybe it's just just regular migraines, or maybe they're just teenage, so it's hormones and stuff. And then when we do different tests, we realize, okay, this patient meets the criteria of being diagnosed as hypertensive or diabetes. And we've noticed that this is so because of lifestyle change, of the lifestyle that we have. So once upon a time, we used to eat a lot of ground food. You had your breadfruits, your dasheen, your potato, yam. You cook a one pot, a fish soup or something. And now we notice that
a lot more processed
we have a lot
food.
more processed food. So we're eating a lot more corned beef, canned stuff. Everyday KFC lines full.
One person did point out to me that, but this is an older person, so I do understand and respect that times have changed, but back in times gone by, children didn't necessarily choose what they wanted to
True.
eat.
Yeah.
Apparently right now a lot of the young parents, they allow their children, I'm all for freedom of choice, I'm all for helping your child become sovereign, but you have to teach them to make healthy
Decisions,
choices.
yeah.
So then if your child has a penchant for KFC chicken, you can't give in all the time.
Yeah.
So I'm guessing that's probably part of the issue.
Could definitely. I remember once upon a time, junk food was like a
And
once
a
a
treat,
year,
yeah, like a
once a year
treat.
occasion on your birthday, and you're like, oh my God, I
I've
have
experienced
KFC.
it. Like if I don't eat what my mother cook, I just don't eat,
Eat
and then
at all.
when I get very
Correct.
hungry, I just eat the same food that I was
Exactly.
given a fuss to eat.
Exactly. And because of this, freedom of choice and stuff like that, you realize that, we have these incidences. Not only that, but during lunch period or break time, it's sodas, sweet stuff, corn
enough
curls,
water.
and not enough water. Sometimes children go weeks without drinking water because when they're thirsty, they drink.
Gentle parents.
They drink a lot of juice. It's always juice, and then
So the sugar
the
intake
sugars
is
exactly,
higher.
and it's from
Okay.
an earlier age. I remember when I was a child, candies was like, wow, if you get one sweet a day, you're lucky.
And you got to sneak it too.
And you have to sneak it. You couldn't get, your parents couldn't catch you, having a sweet, because it was like, you ain't even drink water for the day. What is that?
Can I
Correct.
confide in you guys a secret? My mom had to hide the candy from me.
I mean, all of us,
And
right?
You steal it from the
go,
cookie jar, right?
girl, and I would go looking for it. She used to have to hide those things, like in very creative spaces, because I would eat all.
Exactly. So we
Yes.
had like a strict intake of sugar and
More
junk
supervision
food. We had
with
more
what we eat.
supervision, and now that is not the case. You understand? So these processed artificial foods, they're going to your system at a very early age, and the amount that's going into your system at any given time, it's going to break down the organs. Your body's going to be in a constant process of inflammation, leading to hypertension, diabetes, heart diseases, and then cancer. Not necessarily in that particular order, because everybody's body is different. Some persons can eat garbage for the rest of their life, and biologically they're fine. Meanwhile, other persons, they try one or two, maybe they binge out, and then,
And we could talk about why that is from a more biological point of view a little later. But in terms of all of these emerging issues, what are some of the tactics that the Ministry of Health, or even within your own departments, that are trying to combat or mitigate some of these issues?
Well, we've been trying to, the first thing, it's education of the public, right? So we push educating the public. I'm sure you've noticed, those who watch TV and stuff, we started putting up awareness of the amount of sugar that are in different,
I see that ad, yeah.
exactly, that in the sodas and stuff like that. And it's crazy how sometimes one bottle of Sprite has 60 grams of sugar, right? And people drink that like 4 or 5 times a day, and that's fine. But if I was supposed to pour 60 grams of sugar and say, here, eat all of this, you'd be like, you're crazy, you're not doing that. And then things like, ramen or corned beef, or a lot of canned stuff, right? They have things like sodium benzoate or potassium benzoate, and these chemicals
MSG.
and MSG. So all these things are in these things to preserve the food to last for a longer time. But when you eat it, what do you think you're doing to your body?
MSG especially, you wouldn't realize how much salt you're intaking, because MSG, I think, tends to mask that for me personally. If you've ever consumed anything with MSG, it's supposed to be a flavor enhancer, but your body breaks it down and it turns into something else once your body processes it. And I think that is one of the issues for sure.
So it makes you addictive to keep going back for that product over and over.
Exactly. I want to challenge people, right? Like, if you challenge yourself to consume healthy foods, and when I say healthy, I don't just mean more fruits and vegetables, because some people, when they have fruits, they sprinkle a little bit of white sugar on there.
On fruits?
On fruits. Yeah, like if you have like watermelon, you sprinkle white sugar on there, or strawberries.
I've never even heard of that.
I've tried it before. It's really nice. It's really sweet.
But then the fruit has it, and I was gonna stick up in and say sometimes people feel no, because sometimes people feel, okay, well, I'm eating fruit, and a lot of fruit, particularly maybe a pineapple, bananas, that has a very high concentration of sugar.
Yes.
And the sugar in fruits is fructose. So we feel great that we're eating healthily because it's a fruit, but then we're not cognizant of the fact that the amount of sugar.
Yes.
And sometimes we juice the fruit, so it's kind
not
of like
the fiber
sugar
is the
water, so the
important part.
fiber
Fiber
is
is
not
the myth,
there.
yes.
And then you're gonna have that sugar spike, and then you keep having that over and over and over,
And
then
you become insulin resistant and then develop diabetes.
Okay.
Exactly.
So
Exactly.
we have to understand the physiology. Perhaps we need to have like a breakdown of nutrition and how that affects the body, so persons understand a lot more. It's not just, okay, I need a carbohydrate, a protein, a this or that, but the balance and how those things.
And for your age as well.
Yes.
Correct.
Your age, your physical activity, and all that stuff.
Yeah, so I think we really got into the meat of things, so we're going to take a short commercial break and come right back.
Yeah.
Stick and stay.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see, and the climate's changing.
But hope is remaining.
And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we stand. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
All right, everybody, welcome back. For those of you who are just joining us for the first time this evening, my name is Clilia Davis, and I'm ably joined by Dr. Monique Lescott and also Dr. Joeann Davis. So we have been speaking about the health priorities in St. Kitts and Nevis, and we just finished talking about some of those determinants of health, some of the incidences and new emerging issues that we're seeing, such as the incidence of hypertension with juvenile diabetes, and some of the reasons why we would have such occurrences. But I want to stick a pin and just to highlight some of the October observances as it relates to health, because October is a month that's filled with a lot of remembrance, celebration, highlights, awareness. So some of the most memorable ones, I guess you could say, is ADHD Awareness Month. And I think that is on the rise now with our pediatric patients, as well as autism. And there is Breast Cancer Awareness Month. I think everybody knows October is where we highlight the awareness of breast cancer. And I think now it needs to go into Breast Cancer Action Month to make those actionable steps. Also, we have Domestic Violence Month. We have Health Literacy Month and Mental Awareness Week, which is typically celebrated or highlighted within the first week of October. So I just wanted to highlight some of those things because a lot of them are very relevant to the topic this evening, and we're going to be bouncing back and forth. So we also are going to speak about the determinants of health. We started speaking about some lifestyle choices, specifically when it comes to nutrition. And I think we all know that exercise as well, and the correct type of exercise is very, very important for that holistic, healthy lifestyle. What about our access to care and health literacy? Do we think that plays a vital role in terms of the determinants of health and maybe some downstream effects in reference to maybe the incidents that we're seeing with some of these diseases?
I think the access is there, you know. I'm not sure sometimes if persons, I think sometimes it goes over some persons' heads though, because it's easy to think because we have a so-called modern society, we assume that everyone has access to a phone, a tablet, the internet, Wi-Fi. That's not necessarily always the case from what I've seen. And I don't think persons, I mean, I guess we have a good amount of people who still listens to the radio, but I think a good amount of persons don't really listen to the radio anymore. I could be wrong. Someone chime in here and let me know.
In my opinion, I think that with regards to the access of the medical facilities, it's more about the awareness or, you know, health literacy. Unfortunately, in my opinion, I think that our population, we're not exactly health literate.
So then that's what I was thinking, maybe because
Yes.
a lot of persons, we might assume, might have access to the internet, which is where a lot of this information will be easily accessed. But sometimes I get the impression that a lot of persons don't have access to Wi-Fi as we might think.
I think they do, but maybe their researching skills are off. For example, maybe because we are in the medical field and we understand medicine, we think that, okay, just because you have a cold and you're coughing doesn't mean that you have stage 4 lung cancer. However, if a non-medical personnel Googles, hey, I have a cough for like about 2 weeks, what's
Then I
wrong?
probably think they got
Then
all sorts of
you probably
things.
go on WebMD or something like that, and he's like, hey, you probably have stage 4 lung cancer.
And that's not the
And
case.
that's not the case, right? So I think that we have access to that, but because we're not literate in health, we
don't know what to look
we
for.
don't know what to
So
look for.
that means we are here to bridge that
Exactly.
gap. So
We're trying.
Yes.
So we do try with programs such as HealthWise,
Yes.
and we also have medical bulletin boards and all that stuff. But what I've also noticed is that in our population, we tend to go to the general hospital for everything, not realizing that we have
The
clinics and community health centers. And most of the cases that we see in the accident and emergency department are best suited for the clinics and the and the community health centers. However, persons would complain and say, but the health center never got nothing. And I would ask, you sure? No, my friend tell me that she went there last week and they had what she come for, so I just come up here. That's not how it works. That's not how it works, right? And if there is a shortage, right, I think the Ministry of Health would work together to make sure that each of these departments, each of these clinics would have the necessary resources to look after the population. And because we have community health centers, these community should be stocked for that particular community. So if you live Keon, there's no reason for you to be coming all the way to Basta Health Center. Because now you're putting extra pressure,
Or even JNF.
or even JNF,
JNF.
because now you're putting extra pressure on these institutions, whereas you're in Keon. Keon should have a health center.
So can we give the general public a great overview of how the health system is broken down? Because I know there's community-based health, there's institution-based health, and there's like health promotions and stuff like that. So within community-based health, that's where we would have the clinics and health centers. And then the institution-based health would be like General Hospital, Paxson Medical Center, Mary Child's Hospital. So then in medical terms, or at least medical administration, we would have like primary care, secondary,
And
etc.,
tertiary.
and tertiary. So primary will be in reference to.
So the primary care, it would be the community health centers or the clinics, right? And these are responsible for maintenance of treatment for hypertension, diabetes,
Follow-ups and
for follow-ups, exactly, for follow-ups, right? Secondary would be the JNF hospital, which is a general hospital, meaning that it has different departments. So we have the accidents and emergency departments, meaning that if you have an accident or an emergency being that you are dying or very close to dying, an accident being that you will end up in a car crash,
But you know, to some kittians, an ant bite, a centipede bite, they're close to dying.
No, right?
So is that something that you see in the outpatient department then? Like if I break my hand?
That's an accident.
That's an accident. Okay, so what is not considered an accident or emergency?
A centipede bite?
A centipede
Or
bite.
if you've been experiencing
But if I get a
chronic pain, but if you've had something chronic for more than, let me not even put a time frame on it. We know what chronic is. You have a chronic issue. That's not an accident or emergency.
Okay. What about chest pain?
Okay,
course.
so chest pain, definitely. If you're experiencing chest pain, yes. If you're experiencing shortness of breath, you're having an asthma attack, that is an accident and emergency. If you or a family member had a stroke, if you're bleeding profusely, if you would have, if you had like diarrhea or profuse vomiting, those things are considered accidents and emergency.
Emergencies.
But we have to take a quick break. So we're gonna pause for now and then continue as soon as we get back. What?
Another day in the books. Well, hello there. She pretty from head to toe, and are you ready to go? Wait there. Whew. Can't afford to slip up. Not even in my dreams.
So we're back, and as I was saying before, we were talking about what would be considered accidents or emergencies. So as I was saying, I was given a list of what would be considered accidents and emergency, what would be quickly seen in the A&E department. And as I was saying, if you have vomiting, extremely high fevers, profuse diarrhea, bleeding, you have obviously broken bones, stuff like that, those would be seen as accidents and emergency. Those have priority. However, if you come to the accident and emergency department because of a centipede bite that you had 2 days ago and it's still hurting you, you will be seen, just not as quickly as you would like to be seen, because it is not an accident or an emergency.
And we need to remember that the average wait time in an emergency room, even overseas, is, what's the average wait time? Like, it could be upwards up to sometimes 10 hours or more.
Yeah.
I've had persons be very upset and irate that, well, I've been here since 11 o'clock and it's now 6 o'clock and I have not been seen as yet. And then when I check with the emergency room staff, behind is a whole
Chaos.
tornado of stuff happening, because while you're at the front seemingly quietly waiting at the front, the ambulance has just came with a whole set of casualties, and that's what sometimes the public don't necessarily see. So I try to be a bit neutral with persons, because I can understand the frustration of being in an institution. You're not feeling well, but then there's someone with a much bigger problem that needs to be seen before you. So sometimes I tend to just stay on the fence. I try not to fan the flames or escalate the matter more than it needs to be. I try to get people to just understand that the staff is doing all that they can in as much a shorter space of time as they possibly can, and to just try and have some patience.
Yeah.
I know sometimes that doesn't work. People want to be
So
seen and just
can we
leave.
explain to the public about the triad system and how that works?
Okay, so the triad system, this is basically a system that is responsible for determining persons who need to be seen urgently, going all the way down to non-urgent cases. Now, urgent cases, as I was saying, is that if you have shortness of breath, a patient just had a stroke or chest pain, and it has to be realistic chest pain. Just because you have, some people confuse chest pain. They say, oh, my chest has been hurting me for 2 weeks, and because it's chest pain, I should be seen urgently. When you come in and your triage, the nurse takes your vitals, she takes a history of everything, and she or he determines how urgent the matter is.
Based on the vitals?
Based on your vitals, not based on what you say. Your vitals have to correlate with what you're
it's
saying.
not based on the nurse's mood either. As you say, it's based on empirical data.
Exactly.
From whatever the tests, whatever the, what you call those?
The vitals.
The devices that read your vitals. It depends on that. But sometimes I think we feel, as a public that, well, she's just not in a good mood, or this nurse is not dealing with me properly. No, it's based on your vitals.
It's based on your vitals. So for example, I've had patients who come in and say, oh, they just feel dizzy and they have a headache. When you take their blood pressure, the blood pressure is 220 over 180. Now, this is an emergency. This is urgent, right? And they was like, oh, but this person only have a headache and nothing wrong with them.
Oh dear.
But the nurse will come in and say, hey, this patient has a BP of 220. We need to do something now. The normal BP is, 120 over 80.
But then we could explain to persons why that is an emergency. If the BP is that high, it can lead to a stroke, and that is why the person has to be seen. That blood pressure has to be taken down, or else it can cause ruptured arteries in very many bad places in the body. So that's why we have to see the person.
Or a patient with diabetes come in and, for your normal should be 135. But some patients come in and the glucose is 500, 600, or sometimes the glucometer says error. It just says high, and that's it. It doesn't have a reading. We need to get that down because they can end up in a coma. There's
and they can have seizures.
There's so many crazy things that can happen with these elevated stuff. So it's not just a matter of you feeling bad and you vomit. You only had 3 vomiting and you need to be seen now. It does not work that way, right? And this is why the community health centers are so important, because they deal with the cases of, I'm not feeling well. So it should be that you go there first, and then if it needs to be escalated, they refer you to the hospital. But simple things they should be able to manage it,
Understand. So what about, since you were on that point, now pivoting to maybe bolstering the healthcare system, what are some of the things that you think we could do to help improve the system and its continuity from community to institution-based to making sure that we keep that patient-centeredness between everything? How can we do that?
I see someone wants to get us into a lot of trouble.
No.
There's so many things that can be said. There's so many things that probably can be done to ensure continuity. For one thing, I think it starts from within the institution itself. Sometimes we have to take a hard look at our own selves. We sometimes, what should I say, the staff, in my opinion, a lot more collaboration could take place.
A lot more cohesion.
Yes, that it would definitely start from there. Sometimes it's a stressful work environment and you can't carry grudges. It doesn't make any sense to me anyway. Stuff is going to go wrong. Maybe people might say things out of frustration at times. That in itself can break down communication. It can cause a whole heap of problems when it comes to persons having to or needing to work with each other. It sometimes I would think a little bit more collaboration is needed, I think.
But outside, sorry, go ahead.
Sorry, I was just going to add on to her point that outside of collaboration within the institution, and we're already promoting education, I think that one of the most important things we have to do, or we should do, is that once we agree as an institution that this is the standard and this is the protocol, we stick to it no matter what. There should not be any leeways, no loopholes. If we decide that, hey, in this situation, we are going to do A and that is the standard, then
The standard should be
upheld for all cases. It doesn't matter your social status, your marital status, your age. It shouldn't matter, because this standard is put into place with taking into consideration all of these factors. And I feel like sometimes we tend to forget, or we tend to make decisions based on emotion, and that causes us to have a double standard, and then that eventually leaks out and just causes chaos everywhere. So then you would say, oh, the hospital is not organized, because when I came here the first time with this person, she treated me nice, she do X, Y, and Z, but she may have done the thing wrong. It just happened that you seem to have benefited. And when somebody...
Or you just like her attitude
more. Or you
more.
just like her attitude more. But when somebody else comes into the picture and they said, no, this is the standard, this is the protocol, and because you don't like
so
it...
there's consistency throughout.
Exactly. I think once we're more consistent, it should be better.
Consistency is what we're looking for.
So you guys spoke about the social aspects and also probably like the more human resource side. Are there any technical aspects that we could implement between, let's say, for operations? The cohesion of information. So we are telling the public that there is a primary, secondary, and tertiary system that we need to follow to make sure that things go a little bit more smoothly, right? So how do all of those tiers communicate with each other through data collection, the passage of data, who owns that data? And when I say data, I mean like patient records, medical records, things like that. How can we employ tactical skills to ensure that this type of information, the operations itself, the persons who are working within those things are going to be nice and cohesive, right? I guess you guys will be able to tell us that as soon as we come back from this commercial break. Thank you.
Every smile, every hug, every step our children take is a precious gift. For 50 years, vaccines have been the shield protecting those moments, saving 6 lives every minute around the world. That's 8,000 lives a day. Thanks to Vaccination Week in the Americas, 1.2 billion people have been vaccinated across more than 40 countries. In 2024, we celebrated 30 years without polio and reaffirmed our region's status as measles-free. But there's still more to do. For 2030, PAHO has set the goal of eliminating more than 30 communicable diseases. This goal is about caring for our future and for our communities, our health systems, and boosting socioeconomic progress. One of our top priorities is to become the first region in the world to eliminate cervical cancer, a disease that took more than 40,000 lives in 2022 alone in the Americas. To this end, PAHO supports countries in reaching at least 90% vaccination coverage rate for the human papillomavirus in girls under 15 years of age. Also, some countries are already vaccinating boys, which will help achieve the overall goal. But there are still children and adolescents without access to vaccines. We need urgent support from our leaders, our communities, and from each individual. No child, no one should suffer or die from a disease that we know how to prevent. Why is getting vaccinated essential? Because each person vaccinated is a life saved, a step closer to individual, family, and community development. Because your decision makes a difference. For those you love, for the future, for your health, and for the good of your country and our region.
All right, good evening. Welcome back, everyone. So I was just asking Dr. Davis about the systems that are in place or are going to be in place to help with the cohesion of the different tiers of the medical system, being the primary, secondary, and tertiary. So you were just going to elaborate on that.
Right. So before I get into the communication part, I realized that I did not speak of what is the tertiary care. So tertiary is more for institutions, which we do not have in St. Kitts, and these are more for like cancer treatment centers and stuff like that. So just for your general knowledge. Okay, so to answer your question, we're currently in the process of digitalizing everything so that information about a particular patient can be easily spread across the different tiers of the health system. So most persons would notice that when they come to the A&E department, if you've been to the hospital recently, you've noticed that there seems to be a lot more paperwork, a lot more writing. And this is because we are, finding our way to get as much information about the patient as possible, right? And then having the staff or having the medical personnel becoming used to collecting all that information and having it stored. So you will notice that you come in for a tummy ache, but then we might ask you about everything else after we've already got to that part. So I might ask you, or sometimes we're not even asked, or just observing, you see me just ticking off a lot of things, because as soon as you walk in, I'm already starting to examine you via observation and stuff like that. And all the information that I collect just by looking at you, examining you, speaking to you, I put it on that paper so that when you come back to the hospital and we get your name, it's like, okay, I have this file on you, and this file says that you have this and that chronic diseases, you're currently on this medication, so I know you. So if another doctor was supposed to come and see you, they already have a bit of information on you. We've also been using files. You notice that we would ask for files is like a huge folder. Some persons have thick folders, maybe because they've been in the hospital recently, or they've had cases that call for them being admitted for a long period of time, or they have a plethora of different diseases that needs to be looked at. And others, they don't even have a file because they've never been admitted. But these files are what we use to compile information. But because it's a lot of paperwork and we've now moved into the age of technology, we want to take all of that information and put it up on the cloud so that each doctor has access to the necessary information for each patient.
All right, so I am so happy that you mentioned moving into the age of technology.
So we can have like a patient portal and that sort of thing, so they can also access, sometimes when you go overseas, if you had a procedure done, the hospital website, you can log in.
Oh, for real?
Yeah.
Oh, it wasn't
log
aware.
in, and you can have access to certain things, maybe even if not the entirety of your file. Say, for instance, you might need proof that you were admitted. You can access that yourself.
Okay, so I'm pretty sure that that's what we're moving into.
I'm hoping.
Right, but we're taking baby steps. So we're starting off with the paperwork, seeing all the necessary information that we need. We had a lot of test runs, a lot of trial and errors. We realized what our mistakes were, and now we're slowly moving towards the digitalized era.
So somebody from the public now, and yes, I'm going to be a little devil's advocate, who wants to know, how am I sure 100% that my data is safe, that my medical records is safe, know that it is in the cloud and it is accessible to hackers, and what contingencies are put in place for St. Kitts and Nevis? Because let's be real, we know that having a data cloud or something like that, there's certain licensing that you have to have to keep the data safe. There's certain insurances that you need. Are all of these things being taken into consideration when we do this cloud? Are there any like hardware backups for if something goes wrong with the cloud, etc.? Are we going to sensitize the public in terms of those steps that are taken? And then when we do get this information from the vantage point of a scientist, how can I use it? How can I extrapolate, and how would it be accessible to somebody like me if I want to go and start to do a pilot study? Am I going to be able to have a good repository for me to extrapolate data from my study? What sort of red tape, if any, hopefully not, would I need to, or processes would I need to go through in order to do that? What are the ethical standards? You know, so I'm literally not just asking you so that you could answer each one of those.
Yeah.
I'm framing it in such a way so persons could understand the whole magnitude or the holistic umbrella of what all of these things entail, and therefore understand that it's not going to happen overnight. It's not going to happen with a limited staff, you know. So yes, we have to employ patients when we're seeing this, but we still also have to hold our institutions accountable for ensuring that we do what we have to do.
I agree.
Right? And we do it in an efficient way and essentially not waste time. Right?
I agree. So to answer your question, I am not, as of this moment, I don't have the necessary information as I'm not privy, that's not my department. However, I am sure that once, you know, in the process of making this cloud or putting up this information, it needs to have the security to protect the.
They're going to be encrypted.
It has to be. It has to be encrypted because, not as doctors, as medical professionals, we are dealing with confidential information for patients, all right? And despite how you may feel about a particular patient, when it comes to our job, there is a very bold black line between what you can do and what you can't do, right? And that thing about medical patient confidentiality, that is what holds us accountable and responsible, right? You should be able to come to me and tell me everything, right? And just because I don't like it, I can't go and tell other people about it. That's my job. And if you find out, hey, I only tell this doctor so-and-so, but this neighbor come back and tell me, you can go to the law and hold me responsible for that. So with that knowledge in mind, having that, once we get to the point of having our stuff, our files and all these portals, everything digitalized, we should hold ourselves to the same standard.
Understand. You agree, Dr. Lescott?
Yes.
Yes. Okay. And so I also want to talk about citizen responsibility, how we could really empower ourselves and also empower each other, because coming back to the health priority aspect of everything, sometimes we feel as if the health system is supposed to be the end-all be-all. And it is literally an interventive care approach. We really should be trying to focus more on the preventative measures that we can do. Of course, if I go down the road and I get knocked down, God forbid, that is not something that I would have prevented unless I was, you know, drinking a little bit too much the night before and walking in the middle of the road. But, you know, we really need to take accountability of ourselves.
Yes.
We need to make sure that we understand our body, we have a baseline, and then we're doing everything in our power, whether that be with lifestyle changes, through diet, exercise, the mental health aspect. We haven't touched that yet, and that is a very, very big one that's now emerging in St. Kitts and Nevis. So I really think that we can stick a pin and we speak about mental health awareness when we come back from this short commercial break. Thank you.
Smart Electronics, your one-stop shop for all your electronic needs. Unlock cell phones, tablets, laptop computers, Bluetooth speakers, TVs, mobile accessories, memory cards, USB drives. We carry all major brands. Now you don't have to go anywhere anymore. Everything's available under one roof. Mont Electronics at Port Sante opposite the food court. Telephone 466-4271. Visit our website at dutyfreesmartelectronics.com. Smart Electronics, way to live a smart life.
Good evening, everyone, and welcome back to HealthWise. So just before the break, we were elaborating on how mental health has now infiltrated our communities and some of the highlights that we would definitely need to be aware of. So Dr. Davis is going to mention a few of those for us.
Okay, so what I've noticed is that I won't say that it's something that's new and emerging, but it's something that we're more becoming aware of. And I'll give you an example. Back in let's say about 10, 15, maybe 20 years ago, if a child was in a low grade in school, and the teachers would say, oh, he's lazy. He don't want to pay attention. He always hyperactive. He's this, he's that. You would hear comments like, the child just don't care about schoolwork, or he just can't read, or he just don't pay attention, he own way, right? But now we've come to see things like ADHD,
learning disabilities
such as dyslexia, we have autism, all these things. So in my opinion, they've been there all the time. It's just now that now we're able to identify what they are, and not only identify the problem, but we can also learn how to treat this problem and how to help these individuals integrate into society, right? But with what Ms. Davis was saying, she was talking about citizens being responsible for themselves, taking responsibility for their action, as the medical system is not the end-all be-all of everything, right? One of the things I want to impress upon is the fact that we as individuals, when it comes to our health, we are very irresponsible, right? And we like to put the blame on the doctors, right? Some patients, they come to the hospital and the doctor say, hey, well, you've been coming to my office for such and such a time, and we've done all the tests, and now we're gonna diagnose you with hypertension, or we're gonna diagnose you with diabetes, or we're gonna diagnose you with a heart problem. And we're gonna give you this medication to help you control the disease, control whatever it is. And this is the way you have to take it. You have to get a refill. And with lifestyle changes, eventually you will be able to get to the point of not taking the medication. For some persons, other persons, you have to take this medication for the rest of your life. And they say, okay, doctor, thank you. And the information, he said, goes to this ear and comes out the next. Sometimes they don't even reach your ear, just go straight over your head, right? Or you come home and say, this doctor give me all these pills. Why I taking all them pills for? I'll just drink some merengue bush. I'm going to just drink some neem bush and I'm going to be all right. And then you get sick, you get a stroke, you come back up to the hospital and you say, the doctor said, but what happened to you? The pill them you give me now work.
And
but you haven't been taking the pills. You haven't, is it that you haven't been?
I think some patients, they think because we're not there to witness whether or not they're taking the pills. I've had that experience before. How should I explain this to them?
Your body doesn't lie.
Your body will literally tell us whether you've been taking the medication or not, whether you have it in your system or not. It's going to tell in your vitals, especially when it comes to diabetes and hypertension.
Yeah.
If you're not taking your medication, it will definitely show in the devices when we check your vitals. There's no way that even if you miss 1 or 2 doses, the diabetes, the measuring will go off the Richter scale,
like
basically.
500,
like
600.
Even if you didn't take your medications the day before, or even if you missed a few doses, there's no way it's going to just skyrocket like that unless you have been negligent for some time. That's what happened. So we will know.
Exactly. And I think it's crazy that patients would blatantly lie to your doctor.
No, I think what happened is we look young, and I'll say this on the TV. We look young and we look naive. So, especially if they're older, I've had that experience where if you're looking too young, your face looking too smooth, they figure that you don't know what you're doing. So they blatantly lie like it's nothing because they figure we won't figure it out.
And I just think it's
Wait
crazy.
a minute. They figure it out.
I just think it's crazy that you would ask them, hey, do you have any chronic disease? I say, what do you mean by that? You say, okay, do you have sugar? Do you have pressure, high blood pressure? They're like, no, I don't have none. Do you take any medication? No, I don't take no medication. So I look at the chart. So you don't have high blood pressure? No. And you don't take any medication? No. Okay, no problem. Patient says that they don't do this. And then another doctor comes, or a specialist, and the doctor might have known you. Oh, but where your medication? And then I'm like, but you said you wasn't taking any medication. Oh, you mean them white tablets? what white tablets? What? You told me no, you weren't taking anything.
Like that's very, very dangerous.
Oh,
Like that could lead
yeah.
you to make so many mistakes, and then if you do make a mistake, then everybody will be on your case for malpractice. When it's really, it's the responsibility of the patient to build that rapport between yourself and the caretaker. Like,
exactly.
why are you trying to mislead the caretaker? That's very, very dangerous. Like, why
and it's
would
affecting you. It's not
Yeah.
affecting me.
Yeah, for sure.
Well, you definitely brought up some really pertinent points, and always being as solution-driven as I am and trying to have mitigation and being very risk-averse, perhaps the digitization can now go on to the drug dispensing,
Yes.
so work along with the pharmacy so that on the person's or the patient's chart, all of the, not just the history of the patient, but the prescriptions that
Yes.
him or she would have had would be there. So even if they might not be as upfront as we would like, you still have that backup information to say, okay, well, I have now 2 sets of information to look
What
at
the patient is saying.
what the patient is saying and what would have happened previously. And so now as the medical professional, you have a lot more information in your arsenal to make the right decision. And that also helps as a backup too.
I was just about to say that. Not only that, but it helps to protect us as medical professions, because you don't want a situation where it's he say, she say, but you want to have facts, you want to have documentation. Even if I said this patient never told me, and I've had this happen to me multiple times when I was in school, and I go to my patient, do my case study, everything, and the patient said they're fine. I palpate their stomach, and then the specialist comes, we're doing rounds, and as soon as they touch, I'm like, that's not what happened. That's not what happened. You were fine. You said you felt fine. Why are you doing this to me? And now, if I don't have a considerate doctor, he turns to me, he's like, why didn't you do your job properly? And I'm like, but I did. Or he said, this patient said, no, I'm not taking any medication. No, I'm not this, I'm not doing that. And then when the doctors or the specialist come, he's like, yes, I'm taking a Telenol and a Betalol. And I'm surprised, like, you know these names. But you told me you weren't taking anything.
What I used to do when I did my observership in Taiwan is I never went to the bedside alone, because I knew this was a very real prospect. If it is you're alone, then it's your word against theirs. And for some reason, I don't know why patients would just sit and fabricate lies like that sometimes, but I think it's because, one, we're females and we look young. That's the only thing I can figure out is the problem. But one issue I used to have when I did triage, I used to triage in the emergency room when I first came back from med school, is sometimes a patient would let me know their history. For instance, they might have been diabetic for 5+ years. In 5 years, you're supposed to know your medications offhand.
True.
But instead, when I go to take the history, what medications are you on? A pink pill.
Yeah.
So I'm supposed to go and look for this pink pill. How am I going to source this with the pharmacy now? How am I going to ask the pharmacy, do we have this on stock? So yeah, these are some of the challenges.
Just a message to the public. Color, size, and shape of the pill means nothing to us, because paracetamol can come in a triangle, in a pink color. I'm not saying that's what it does, but it can, right? So it's very important that you know the name of your medication, keep on top of that. And I find that persons in St. Kitts, they don't know what they have, they don't know what they're taking, they don't know the condition, they don't know when they was first diagnosed. It's very important to know yourself, know your body, because nobody's gonna know it better than you. Okay, you do not depend on the doctors to know your history of your diseases. We don't know you, okay?
All right, so you've heard it here first from Doctors Davis and Lescott. You need to know yourself, and know yourself you shall, right? So just to wrap up, we have been speaking about the health priorities in St. Kitts and Nevis, and I think we really dived into the more social and human resource part of the operations and some of the nuances downstream that affect whether it's an emerging disease or whether the prevalence of chronic diseases. And these, even though it may look very trivial, very shallow from the onset. When you really think about all of the things that doctors mentioned here this evening, you can see how that can create a domino effect in terms of your overall outcome or the output that you would have. It may not be as favorable as it could be, or you may be on top of things and doing things the best way and having the best outcomes. So we want you to take this and add it, all this information, add it to your arsenal. Make sure that you make informed decisions, listen to your doctors, not just when necessary, just listen to them all the time. Yes, be also an advocate for patients, speaking up for themselves, being strong and saying, yes, I am not a doctor, I didn't go to medical school, but I know how I feel, right? Doctors, you feel confident and feel comfortable saying that your patients should be advocates for themselves, and that is why you need to
have an honest rapport. We need to build
that honest rapport with your
relationship.
doctors.
Yeah.
Not only that,
good baseline. Mm-hmm.
Not only that, but I always advocate to get a second opinion, but not multiple opinions, because too much hands all the pot. But get a second opinion. If you're not sure, if you're not confident with what I'm saying, it's always best to get a second opinion from another doctor. But don't go to all 6, 7, 8 of them, right? The reason why I say this is that we as doctors, we're also human, and we can make mistakes. We can oversee something, or it might catch our eyes or anything like that. So it's very important to get somebody else to look at the same problem.
Yes, most definitely. So I'd like to thank our listening and viewing audience for tuning in this evening to our first episode back on our season 2 here at HealthWise. We definitely had a great show this evening. We'd like to thank the production crew here at ZIZ and all of the persons who would have assisted in the documentation and things like that. So make sure you join us again next week, Monday, same time, same place, where we will be discussing even more things related to health and wellness in St. Kitts and Nevis. Thanks so much for joining us. Have a good night.
Good night.
Good night.